Hi, everyone, and welcome back to the Stories for Hope podcast. I'm your host, Nicole, and in today's episode, we are going to hear from a very special guest, Dr. Amy Stone. She is going to share about a boy named Javen, whom she met while traveling to the Philippines, and the medical intervention that not only saved his life, but also prevented a health crisis that could have devastated an entire Mangyan village. For those of you joining us for the first time, Stories for Hope is a podcast run by Hope for Kids International, a nonprofit whose mission is to bring hope to children around the world through our 4 pillars: dignity, health, joy, and love. This year, we're celebrating 50 years of ministry that began with our founder and president, Tom Agam. To celebrate these 50 years, we want to share amazing stories of hope to inspire you to bring hope to those in need. Let's jump right in and hear from Dr. Amy Stone.
So I first started joining the trips with Hope for Kids to the Philippines in 2017 and have gone with them twice yearly since then. And part of the medical outreaches in the Philippines is to spend a day with the Mangyan tribe up in the mountains outside of Victoria in Mindoro. And one particular time that we were there, we would see all these children who were in school and also the community. And this is an indigenous tribe that has very little access to water, access to medical care. So we're doing health screenings on the children and taking care of any acute problems that we were able to identify. And at one point during that day, and this was in October of 2018, a mother came through with her 3 children, and especially one, when I was seeing him, Javen, he was 5 years old at the time, and he weighed approximately what a 3-year-old would weigh. And they were very pale, all 3 of the children who were with her. And we took care of what we could at that time, but we took note of his name and anything we could to try and find him later, so that we would ask the local partners to follow up with that family. They were very pale and they were very thin, obviously malnourished, but something else was wrong. Something else was missing for them. So then we were very grateful that there's a local contact who is familiar with the Mangyan tribe, who's the preschool teacher, and she went to help and get out there to this village that is accessed only by crossing rivers and sometimes not at all when it's raining. So Gemini went out and found out that the family had very few resources. And this is something I really learned during this trip. You think you've heard about all the hardships, but we found out at that time that the father was working every day, all week, and his job was to fill a pickup truck with rocks from the river, the local river. And he would do that all week, and at the end of the week he would earn the equivalent of $3. So we saw that the children were malnourished because there just really wasn't enough money to feed them. So David and his daughter Miles, they started bringing food up to him, but we had also noticed that he was very pale. They were all pale, so we thought there must be something else wrong. So I hoped that they would be able to get him into a medical center and have a physical exam and have some blood tests done to see what else was wrong, to see if he had some infectious disease or anemia or something wrong. So at that time, it took some convincing because the father's working, the mother has a new baby, and we can't understand those types of conditions. But in order for her to actually bring her child into the hospital to get examined is very difficult. So they first went to the local provincial hospital, which would have been the equivalent of our government hospitals, and they waited and never really were taken care of. So David and Miles took the time and drove them into a private hospital. And finally, at that time, he did have some lab tests done. They found that he had rectal bleeding, and they thought it was hemorrhoids. He was severely anemic. They gave him some medication and sent him back to the village. And we're not exactly sure why he wasn't managed more aggressively at that time, and it might have been because the mother needed to get back to her children. We don't know all those details. But eventually, they were going to try and get his nutrition up, and then he required blood transfusions, and they were finally able to determine that the reason he was having this bleeding was not something simple, but that he had intestinal tuberculosis. So he had been given medications and sent back to the village, but at that time he was too weak. Now he's 5, almost 6 years old. He was no longer able to walk. He was very thin, very anemic. But Miles and Bishop David, really advocated for him and helped the mother bring him back. They got his blood transfusion. They got him admitted to the hospital. And eventually he stayed in the hospital, I think, close to a month, receiving IV fluids, receiving medication. And when we came back for our trip in March of 2019, so we had first seen him in October of 2018, March of 2019, he was just ready to be discharged from the hospital. And that timing is because it's not easy for them to get in for their care. It's not easy to convince the Mangyans that we're trying to do the best for them, because they're suspicious because they've been mistreated in the past. Yesterday, we were so blessed to be able to have that outreach to the school there. And there are now 99 children in the school, which has only existed for 6 or 7 years. So the children are getting educated. And sitting there with one of the 99 children was Javen. And we weren't even sure he was going to be there. But he recognized us, he smiled, he came up. He's a normal 8-year-old boy now, doing well in school, and allowed himself to be photographed with us. And he was smiling and happy and looked great. Later on in the outreach, we had his mother as a patient. She came up, and through our translator, when I said, well, how is Javen doing? Because Javen to us looked great, but how is he doing? And she had the biggest smile I've seen on the Mangyans, because they're shy, and he had the biggest smile, and she said, he's doing great. And it was really overwhelming to hear that, because she didn't just say he's fine or he's doing okay, but he's doing great. And you could just tell, because he would not have lived. And it's also possible that the other children, because they all had to go and get checked, because the possibility of tuberculosis for them or the rest of the village. So it could have actually wiped out many in the village. So I've retired 10 years ago, and I have been so fortunate to be a part of Hope for Kids and the medical mission since then, because it gives me a purpose to my retirement, because I still feel like I have something to offer. And what I really realized, that we impact with our team, with the medical team, so many people, and sometimes it's just those individuals you impact in a very, very important way. And it reminds me of the value of even just one life, because his life was saved by a big effort on a lot of people. And it just shows the importance of valuing each one of them.
Wow, what an amazing story. As many of you probably know, tuberculosis is very contagious and could have spread to other families in that village, affecting and endangering hundreds of Mangyan lives. Dr. Stone's passion and commitment to serving children and families in remote places has saved countless lives, and we are so grateful for the difference she has made in the world among our sponsored children and partner communities. This story is truly inspiring. On many of our mission trips, we do medical outreaches, and as you heard in this story, those outreaches are life-saving. If this story inspired you to want to help, we'd love to have you join us on a trip. You can get connected with us by going to H4KI.org. Thanks again for joining us today as we continue to share inspiring stories and celebrate 50 years of ministry. Have a blessed day, everyone.